I think it's good afternoon now. So I'm here, I'm Kathy Hotmer from UCB, and I have the distinct pleasure to introduce Dr. Sunita Durgalust. She is an amazing patient advocate. I have known her for years, and she's a PharmD at the VA in Westwood, and just a wonderful advocate for patients and a wonderful consultant and incredibly knowledgeable around the drugs that you may take for epilepsy. So without any further ado, I'd like to introduce Dr. Durgalust.
Hello everybody, welcome to Epilepsy Awareness Day this year. Once again, we're here. This is our fifth time around, so it's been a pleasure and an honor to be here to help answer any questions that you might have about medications, anti-seizure medications related to management of your epilepsy. We're going to start off with short talks by my colleagues. I have Dr. Nguyen, who's done a PGY2 residency in neurology at our VA, and she's going to start off by talking about side effects of anti-seizure medications, and she will be followed by Dr. Caroline Grabowski and Dr. Aisha Vayani and Dr. Grace Lee. So go ahead. Yeah.
Thank you, everyone. Thank you so much for joining. As she said, my name is Jennifer. I'm one of the pharmacists at the West LA VA, and today I'm going to talk to you all a little bit about side effects of anti-seizure medications. I wish I had 10 hours to talk about this, because that's probably about how much long we need to just scratch the surface, but I'll try to do my best here. All right, so I just wanted to go over some background, some introduction to the drugs, define what a side effect is, review common side effects of anti-seizure medications, and lastly, address general tips for managing side effects. So things that you might want to do or things that your pharmacist or doctor might help do. All right, so overall, all drugs that are prescribed by your doctor are approved by the FDA. They undergo testing to make sure that they are safe and effective. This does not mean that there's no risks, but it does mean that the benefits of the drug outweigh the risks and outweigh the known risks. So side effects can be identified during that testing period, or they can sometimes be identified afterwards. So that's kind of how the format works. And when we're talking about a side effect, it's an unwanted or an undesirable effect that is possibly related to the drug. They're also called adverse drug reactions, or ADRs. Side effects range from inconvenient to life-threatening. But fun fact, not all side effects are bad. Sometimes they end up being desirable effects. So a great example of this is a drug called minoxidil. It's not an anti-seizure medication, but it's a drug that's used for blood pressure. It was first developed that way. Then they found that about 1/5 of patients develop abnormal hair growth. So now there's a topical formulation that they use for patients who who are suffering from hair loss. So not all side effects are bad. Sometimes they can lead to desirable effects. Here are some factors that affect who does or does not experience a side effect. So it could be based on age, could be based on genetics, use of other drugs, supplements, or vitamins. Sometimes these can interact. And then also underlying diseases or conditions could affect how you respond to a drug. The drug dose and also the formulation, so whether or not it's a topical, an oral, IV, things like that. And then lastly, lifestyle. So for example, if you're a smoker, that could affect metabolism of some of your drugs. So these are some of the factors that affect whether or not somebody might have a side effect. Some general tips for managing side effects. First, communicate, be direct with your doctor or your pharmacist, mainly because the drug is only as effective if you're taking it. So if you are experiencing side effects, don't shy away. We just want to make sure that you're tolerating it, able to take it every day. So that's definitely a conversation to be had. Next is honesty, which is very similar to communication in terms of if you are experiencing a side effect, and they're asking, okay, are you taking your medication every day? You can say yes, but you also want to make sure that you're explaining what you're going through as well. And lastly, know that if you are unable to tolerate a medication, there may be strategies to help you tolerate it, or there might be other medications that we could switch you through. So there's options. Just because you're experiencing a side effect doesn't mean that's the end of the road. All right, so here's a big table. It goes over general side effects that are associated with certain anti-seizure medications. So for example, drowsiness, being tired, fatigued, or lethargy, feeling like a lack of energy, can be associated with drugs like benzodiazepines, phenobarbital, could be also associated with gabapentin, pregabalin, zonisamide, and rufinamide, for example. Some other side effects are tremor. That's associated with drugs like carbamazepine, eslicarbazepine. A big one is valproic acid, especially at the higher doses. So these are side effects that you might experience, but are not absolutely sure that you're going to experience them. They just might occur. Next, we have slow thinking, maybe some word finding difficulties, some memory problems. These are associated with benzodiazepines, phenobarbital, topiramate, and zonisamide. Next, we have insomnia or trouble sleeping. This side effect can be associated with felbamate, vigabatrin, lamotrigine, or even Keppra. Next, we have some hyperactivity, maybe some problems with attention, irritability, maybe some behavioral problems. These can be associated with benzodiazepines. They can also be associated with brivaracetam and its cousin, levetiracetam. Also with perampanil, the phenobarbital, pregabalin, serpental, tiagabin, and valproic acid. Next, we have dry mouth. These ones are this side effect is associated with carbamazepine, eslicarbazepine, oxcarbazepine, gabapentin, or pregabalin. And next we have some mood changes or maybe depressed mood. These can be associated with benzodiazepines, phenobarbital, levetiracetam, and perampanil, as well as vigabatrin, tiagabine, topiramate, and zonisamide. Next we have any anxiety, paranoia, agitation. These can be associated with perampanil. So if you're experiencing any of these, make sure you do report these to your doctor. Nausea and vomiting or GI upset. It's kind of a little bit of all of them, but these can be associated with carbamazepine, brivaracetam, eslicarbazepine, ethosuximide, felbamate, lamotrigine, lacosamide, oxcarbazepine, rufinamide, serpental, topiramate, valproic acid, and zonisamide. Next, we have any loss of appetite or weight loss. Also some weight changes. So some of these could go either way, weight loss or weight gain, so changes in weight. These can be associated with things like valproic acid, gabapentin, pregabalin, cannabidiol, as well as clobazam. Last few here, we have headache. This can be associated with ethosuximide, eslicarbazepine, lamotrigine as well, Keppra, oxcarbazepine, rufinamide, and zonisamide. And then some electrolyte imbalances or abnormalities. These can be associated with carbamazepine, eslicarbazepine, oxcarbazepine, topiramate, and zonisamide. Last couple here, we have reduced bone marrow density. This can be associated with carbamazepine, eslicarbazepine, oxcarbazepine, phenobarbital, primidone, phenytoin, and valproate or valproic acid. And lastly, kidney stones can be associated with topiramate or even with zonisamide. So I know there's a whole slew of them here. Each drug has its own medication guide as well that you could look up and find common side effects of them as well, or talk to your doctor or pharmacist. Lastly, some general tips again. Know when to see your doctor immediately. So I went through a lot of side effects. The ones where you want to make sure that you contact your doctor right away are any sores or blisters or ulcers in your mouth, blisters on the skin, or maybe even a rash, as well as any excessive bleeding or bleeding that won't stop, some stomach pain or tenderness, as well as fever, any unusual infections, or seizures that get worse or more frequent. So these are the ones that you want to make sure you see your doctor right away. And then your doctor or pharmacist, there are a lot of strategies to try to mitigate these. And some things that we can do are change the timing of your medication. They might change the formulation, maybe one that is delayed release so that it's not releasing in your stomach where it could cause problems. And they can also change the dose of your medication. That's another strategy that they might employ, or recommend an addition of another medication or supplement that might counteract the effects. And lastly, they could recommend that you continue as some of these side effects do go away over time. So these are all kind of scenarios that could happen. And with that, I just wanted to bring up our next speaker, and we'll be taking questions for all of the presentations at the end. Next, I'd like to introduce our PGY2 pharmacy resident, Dr. Vayani, and she's going to talk to us about adherence to anti-seizure medications.
Hello everyone, my name is Aisha and I'll be going over adherence for the next part of our talk. So to give some background to start off with, epilepsy is a chronic disease, and given that this disease is chronic in nature, it often always means that patients will have to take medications long term, and this can often be burdensome for individuals as they are keeping up with these regimens that can often change as well. So ideally, individuals with epilepsy will be treated with only one medication, but oftentimes if one medication is not enough to control the disease, they often have to be added on additional medications to their regimen, which can only further increase the burden of keeping up with those medications. I wanted to define the word adherence for everybody today. So adherence means the extent to which an individual will take their medication as prescribed with regards to their dosing regimen in terms of the dose itself and the intervals. There are several consequences for poor adherence to consider. The first one being that oftentimes when patients miss doses, this can actually lead to increased hospitalizations and ER visits. And with the risk of seizure increasing, this can also increase the risk of injury. So for example, patients could fall, have head injuries, and injure themselves beyond that further. Seizure risk actually can increase by 20% in individuals who are non-adherent versus those who are. As many as 40% of adults with epilepsy are non-adherent to their medications, and this can actually pose an additional complication for providers who may incorrectly assume that patients who are not having their seizures controlled in their medication are actually refractory, meaning that they're unable to respond. And so your provider may react by adding on more medications to your regimen, which will only increase the burden of taking all of those together even further. Furthermore, non-adherence to medications can also increase the risk of more severe complications like status epilepticus, which is essentially a seizure that can last for more than 5 minutes. And research has shown that patients who do experience status, oftentimes more than a third of them are experiencing it because of some form of non-adherence to their medication. So in regards to adherence, there are some barriers to consider, and following that we're going to go over some strategies to try to mitigate those barriers. The first one is adverse side effects, which can be very bothersome for a patient and may make them less motivated to take their medication. Furthermore, a lot of regimens for seizure medications do require dosing that can be 2, 3, even 4 times a day, and so this pill burden can really add up. Next, in terms of cost for newer medications especially, they can be quite expensive, and it may be a challenge for patients to pay for these medications. Next, it's also important to consider patient-prescriber relationships, and by that what I mean is if a patient doesn't have the right kind of trust or sort of teamwork aspect with their provider, it may be difficult for them to commit to taking those medications. And lastly, when it comes to the immediate consequence of non-adherence, if you miss one dose of your regimen, you may not have a seizure right away. And so the lack of that immediate consequence may make someone have some kind of false sense of security that they can be a little bit non-adherent, that there can be some leeway there, when in reality you should try to avoid it as much as possible. So I wanted to go over some strategies next. The first one being that it's a really good idea to work with your pharmacist and your provider to establish goals of care and to understand what the purpose of your medications are. For any time that you may either switch to a different medication or have one more added on, it's a really good idea to ask your provider why it's happening and better understand their rationale so you can be on the same page with them for what your goals of therapy are. And also it's important to remember that trial and error is often a big sort of hallmark of trying to control your epilepsy and your seizures and to not get discouraged if things are changing or if things are being added on. Next, another thing to consider is simplifying your regimen. And for a lot of medications to treat seizures, they actually do come in an extended release formulation, which means that they can be dosed once daily. And so if this is possible for you, it's good to ask about that because this can actually be a really great strategy to try to reduce pill burden. Next, it's good to coordinate with your provider and with your pharmacy to try to reduce the prescription pickup visits because it must be cumbersome for certain people to have to go to the pharmacy over and over again, sometimes more than a couple times in a month to get their medications. And so asking about 90-day supply is a good way to try to better improve adherence, as well as working with your pharmacy to try to synchronize your fill dates so that way you can try to get all of your medications closer together as opposed to having it all spaced out quite a bit. When it comes to side effects, it's really important to understand minor versus major side effects. Minor side effects can be very bothersome and they should be reported to your provider, but this should not necessarily be a reason to stop your medications altogether. Major side effects, however, are very concerning and they should be reported right away so that your medication can be safely discontinued. But nonetheless, it is important to distinguish between both of these so you don't self-discontinue your medications on your own without proper guidance from your doctor or pharmacist. Lastly, physical and electronic reminders are a great way to keep up with your regimen. So for example, having electronic reminders like cell phone alarms can help to prompt you whenever it's time to take your next dose. And oftentimes your pharmacy can send you text messages letting you know that your next refill is due, so you can keep up with that as well. Other things to utilize include weekly pill boxes where you can actually arrange your medications ahead of time and they're already ready there for you to take. Also using medication calendars, so if you're a visual learner, you can kind of see right in front of you when to take what. And then having an updated medication list at all times so you can be well aware of what you're supposed to be taking. Storing medications in areas that can also prompt you to take them is another good strategy. So for example, keeping your bottles near your nightstand or your coffee maker if you take them in the morning can be a good way to remind you to take them as soon as you wake up. Or associating these tasks with other tasks can also be a good strategy. So for example, if you take your medications twice a day, maybe you could associate that with brushing your teeth. So that way, when you brush your teeth, you can take your medication before or after, and that way you can have a good sort of prompt or cue to help you remember when to take your medications. So that concludes this part of our talk, and next we're gonna go over some outpatient pharmacy tips.
Hi everyone, so my name is Dr. Caroline Grabowski. I am also a pharmacy resident at the VA. My personal background is that while I was in school, I spent 6 years working at CVS. So I have a lot of knowledge about the intricacies of outpatient pharmacy and trying to advocate for my patients in that setting as well. So hopefully this presentation will give you some guidance on how you can be best informed about how the pharmacy works and what you can do to try to help assist that process to avoid any delays in getting your medications. So this is an outline of the behind-the-counter prescription process. This looks very complicated, and this is not even everything that they do behind the counter, but this is just kind of an outline to show you kind of the different pathways that the pharmacy staff might take to process your medication. So if you are bringing in a new prescription to the pharmacy or your doctor has sent it in, once the pharmacy gets it, they're going to process it through your insurance. And at that point, they'll find that it is either approved or denied. And if it's approved, then they're going to fill it. That's great. And if it's denied, then that usually means one of two things, either that the medication is not a formulary medication to the insurance or that it requires a prior authorization. And prior auth is something that really is confusing to a lot of patients because usually the response I get is, but my doctor wrote the prescription, isn't that authorizing it? And unfortunately, yes, that is authorizing it, but the insurance requires this additional authorization in order to pay for it. So they have some sort of limitation they want, usually for more expensive medications, the insurance wants some kind of proof that this medication is necessary for you, which unfortunately adds another step. But in that case, if that is required, then the pharmacy will notify the doctor that either the medication is just not covered or that it requires this additional step. And then from there, the doctor can either change it to another medication, they can continue with the medication as it was originally ordered, which means that you might have to pay out of pocket or try to find some sort of coupon card for it, like a GoodRx, to try to reduce your cost. Or if it's for a prior authorization, they can file with the insurance to get that prior authorization approved, which just means that they need to submit some information about you, your illness, or the medications that you've tried before to show them that it's necessary. So once they file that prior auth, it will either be accepted or denied. And if it's approved, then the pharmacy gets to fill the medication. And if it's denied, then we do kind of come back to the doctor can switch it to something else, or they can advise you to continue as is. And in that case, you might have to pay out of pocket. So then we will go to, if it is a current medication that we are refilling, so there's already a prescription on file, then one of two things happens. Either that prescription has refills left on it, which is great, that means the pharmacy can fill it, or there are no refills left. If there's no refills left on that medication or that prescription, then the pharmacy is going to call the doctor and see if that medication can be renewed upon the patient's request. Usually the patient does have to ask the pharmacy to do that. And then it will either be renewed by the doctor, so they'll send in a new prescription for it, and we'll run through this whole process again, or that renewal will be denied by the doctor. And usually that means that the doctor just wants to see you in the office. Most offices have a rule that if they haven't seen you in the last 12 months, that they will want to see you again before they approve it. If you need some time to get that appointment in, then usually they will be willing to send in like a month or two to cover you until they can see you in office, so that you don't go without it. But you just need to call the doctor and let them know what the situation is. So then the other hand is that there are refills left. We can process that medication, and in that case we still might have some insurance issues even though you've gotten the medication before, which can be frustrating as well. That usually means that either the refill might be too soon, and that can be for a variety of reasons. Maybe you're going on vacation, usually out of the country. Maybe you're going on a cruise, or you're going to Europe, and you won't be able to fill your medication while you're gone. Or it can be that the medication was lost, or unfortunately your insurance can kind of change their formulary at any time. A lot of times they do it quarterly, so there might be some sort of change where maybe now a prior authorization is required, or a prior authorization needs to be renewed. So we can follow that pathway with the prior auth, or for those indications where the refill is too soon, if it is something for a vacation or that the medication was lost, then you or the pharmacy can try to call the insurance and assist in getting that overrided. They just need some additional information that they put on file for you. So then we get past all of that and we get to the point where the pharmacy is going to fill the prescription. And unfortunately, sometimes the medication is out of stock. They don't have it at all, or they just don't have enough to fill the full prescription for you. And in that case, they will order it for the next business day. So that means weekends and holidays, they will not be able to order the medications for. So it's important that you plan ahead, anticipating that they might be out of your medication, and give that extra few days so that they can get that done. Once they have the medication though, then they will fill it, they will dispense it to you, and with any new medications or as needed or at your request, they will counsel you on that medication. So some other pharmacy tips. So having a relationship with your pharmacist can be really helpful, especially when you have medications that maybe frequently do need to be ordered. It's not a common medication that's always kept in stock, or it is one of those medications that they can only fill like 2 days prior to the due time. Having that relationship so that your pharmacist knows who you are, they know kind of your history, and they know what kind of barriers you have, can help facilitate this. So if you feel comfortable, share your story with them, share any barriers that you have. I know a lot of our patients with epilepsy are not able to drive, so they have some transport issues that they need to deal with. So expressing that to the pharmacist or to a technician that you know well can be really helpful. Also, take some time to discuss any of your new medications. So they will always offer to counsel you, but if you have a new medication, accept that counseling. Even if they might ask you, do you have any questions today? Even if you say like, well, no, I can't think of any questions, but I'd love to get some information about this new medication, then the pharmacist can come and speak to you. Always review your medication list with your pharmacist. So sometimes people will fill medications at multiple different pharmacies or anything that you're taking over the counter. It's important to make sure that your pharmacist has that compiled list and to discuss that with them so that they can be aware of any counseling points that you might need. Any questions about side effects, any contraindications for your medications, or drug interactions, again with medications either filled there at another pharmacy or things you take over the counter, are all things that your pharmacist can help you with. And let the pharmacist know about any potential side effects you think you're experiencing from your medications. Anything new that pops up, either you started a new medication or you changed a dose or you're taking a new combination, anything new that comes up, your pharmacist can advise you if there's any steps that you can easily take to mitigate new side effects. And then again, calling in your refills 7 to 10 days before running out of your prescription can be very helpful to make sure that there's no delays in getting your medication. So like I said, sometimes they have to order that medication, holidays might get in the way, pharmacy might be closed because of the holiday, so making sure to give yourself ample time to get that medication filled and an opportunity to pick it up. You can also ask if you can autofill some of your medications. Unfortunately, not all pharmacies have this service, but for the ones that do, they will automatically schedule the refill to be done. And in that case, a lot of times they can also auto-send those renewal requests to the doctor as well. Always check your prescription before leaving the pharmacy. So even after you pick it up, just open up the bag, kind of take a look at it, make sure that it looks right to you. Sometimes the pills in the bottle themselves might look a little bit different, and that can just be because it's a different manufacturer, and they can clarify that for you right then and there before you leave. And if there is a problem, you think, oh, this isn't my dose, or this isn't right, this doesn't look correct, then they can handle that right then. Unfortunately, once you leave with the medication, they usually are not able to take it back. And also check with the pharmacist before taking any over-the-counter products. And if you come in, you're feeling ill, you feel sick, and you want to go pick up, some like NyQuil or ZQuil or what have you, you can always ask your pharmacist, bring it up to the counter and say, is this safe to take with my medications? And they can look it up and advise you if that is safe or if there's a better option for you, or sometimes if there's just a better option to control your symptoms that you're having. And at this time, we'll take medication or questions from everyone. Oh, I'm sorry. Yes. Okay. Okay. We'll have one more. Sorry.
Good afternoon. As we wait for my computer to boot up, my name is Grace. I am one of the pharmacists from Chalk Children's Neurology Clinic, and my password is incorrect. Okay. Alrighty. I think so. Yes. Great, thank you. All right, and so my portion of the talk is going to be about seizure clusters. Yes, about cluster seizures as well as rescue meds that we give for this condition. So, by definition, seizure clusters are also known as acute repetitive seizures, and they're basically acute episodes of increased seizure activity that differ from a patient's usual seizure pattern. It can actually consist of different seizure types, and we see this most common in patients with pharmacoresistant epilepsy. And the reason why the recognition of this is important is because we know that prompt treatment is critical to prevent the seizures to deteriorate into something more serious. Untreated seizure clusters can lead to status epilepticus and potentially neuronal death. So it's important that we abort these as soon as we can. A class of medications called benzodiazepines are actually the first line of treatment. And just to nerd it up a little bit, it basically works on the inhibitory side of an epilepsy pathway. So we think of epilepsy as an overactive neuronal pathway, usually involving the glutamate system. And so the kind of counterpart to that is the GABA system. And so benzodiazepines work on GABA receptors, and they basically make it, they bind to a receptor that kind of slows everything down to make it less likely for neurons to continue to conduct seizure signals. And so the characteristics of an ideal rescue medication are that it should have a rapid onset of action, and hopefully we want it to last for a long time because we don't want to be giving medications over and over again. It should have consistent and efficient absorption into the bloodstream regardless of what route we administer the medication from. It should be easy to use and have a very short time to administration, meaning we're not fumbling with lots of devices and difficulty positioning the patient in order to get the medication into the system. And it should also have a good safety profile with good tolerability. Those are our goals for rescue medications. So currently in the United States, we have 3 rescue medications that are benzodiazepines. If you're in the hospital, you get IV benzodiazepines. Usually lorazepam is what we give. And so for having it in a delivery system that is available for patients who are not in the hospital was really huge. And so in 1997, the first one to be approved was Diastat. It was a rectal gel approved for patients greater than or equal to 2 years old. And then nothing happened for a really long time until till 2019 when we made improvements, and now we have the introduction of a nasal spray called Nasolam. And then shortly thereafter, we had a second nasal spray called Valtoco. And you'll notice that there's slightly different ages for which these medications are approved for. So just to quickly go over some of the characteristics of these 3 medications. So the first one, Diastat, is diazepam. It's given rectally, and it comes in this, can you see the cursor there? But it comes in a little syringe like this. The smallest dosage form is 2.5 for our teeny tiny kids. And then as you get up in age, we actually have these devices called the AccuDial, where your pharmacist will actually dial in the dose that was prescribed by your doctor, and they lock that dose in so that in an emergency situation, you're not having to do that yourselves. It's just ready to use. Now, it's given through the rectum, and so obviously we have to position the patient in a way that make them, able to receive the medication in this way, and then we'll stick the syringe into the rectum, and you'll push the plunger, keep the buttocks tight and closed for absorption. And then in terms of general side effects, as a drug class as a whole, all benzodiazepines have the potential of causing sleepiness and tiredness, as well as slow and shallow breathing. So this is common to all 3 medications that we watch out for. Additional doses can be given after 4 hours. So as you can I think quickly it became apparent that although this was a very effective medication, there is a lot of social anxiety about giving this, especially in a public setting. Also, if you have patients who are wheelchair bound or larger in size, it may not always be easy to get the patients into the right position to administer this medication. And so the drug companies worked really hard to reformulate benzodiazepines. And so what they came up with, the next one is midazolam, and given intranasally, also known by the brand name of Nasolam. And so this was a 5 milligram intranasal spray. It comes in one flat dose, and all you had to do is open up the package and stick it up your nose and give it a good squirt, and that was it. And you can actually repeat this medication in 10 minutes if the first dose is not effective. So this obviously improved upon the delivery system. Some similar side effects as the first two I talked about, but with a nasal delivery device, some of the other side effects included a runny nose, nasal irritation, even throat irritation as well. And some of the tips for giving this medication is that you want to make sure that it's not something that needs to be primed, meaning once you put it in your nose, you just go ahead and give it that squirt. And once you squirt it, that's it. So don't try to, squirt it when it's outside your nose, because you're going to lose drug. And then lastly, the last intranasal delivery medication is diazepam or Valtoco. This medication has a couple different doses that are individually packaged in the device, and depending on how old you are, you may be getting just one squirt using one device, or for some of our bigger doses, you might actually have to get 2 squirts, one in each nostril, to deliver your full dose. But again, very similar administration instructions as Nasolam, very similar side effect profile, and for this, additional doses may be given 4 hours after the first dose. So in terms of overall, if you were trying to compare these 3 different medications, there actually have been no head-to-head studies comparing the 3. Looking at the relative onset, so how fast it takes for these medications to kick in and for you to start to see an effect, they're generally within minutes that you will see an effect. You should start to see the seizures start to slow down if it's going to have an effect. And then in terms of effectiveness by percentages, now keep in mind that these designs, again, they were not head-to-head, so these are just kind of numbers that are taken from various different studies, also potentially with differing patient populations. But generally speaking, they were quite effective, good percentage of patients, 77% for Diastat, 54% for Nasolam, 87% for Valtoco, all responded quickly and had sustained seizure control, meaning we didn't have to give a second dose. Now, again, when you're comparing these percentages, don't take a whole lot of stock in looking at them directly like that, because, they all kind of had different periods of observation, but needless to say, these rescue medications are very effective and are very crucial to our patients. So how can you get the most out of your rescue medications? So first of all, having fast recognition of seizure clusters is really important. And so you do want to talk to your doctor and establish a seizure action plan. In the pediatric population, this is very common because the schools require it. I think in adults it may or may not be as much, but do talk to your doctor and establish, when should you be giving this medication, recognize what a seizure cluster is, and then for fast administration, always remember to carry it on you, because you can't give what you don't have. Your pharmacies should allow you they can fill multiple prescriptions so that you can have a backup supply somewhere where you need it. If it's not used very often, make sure to check expiration dates as well. The last thing you want is to open up a package and for it to be expired. And make sure you practice how to use it. Rehearse it in your mind, get your hands on an applicator and try it out, feel it, because you don't want to be fumbling with it the first time when you're in your middle of a seizure cluster. And hopefully with these tips, we'll get better outcomes for our patients. All right. That concludes my presentation, and we will have our panel at this point. Thank you.